Venice was a gateway for people, a place of arrival of goods, and as you can easily imagine, being so cosmopolitan, it was also exposed to epidemics. This has been the case since the so-called Black Death of the 14th century, which came from the Levant to all of Europe with devastating effects. It is estimated that it killed between 20 and 25 million people, 1/3 of the entire European population. The contagion probably began in Asia and was brought in Crimea, in Kaffa, then a Genoese colony, by the Mongol troops who were besieging the city. In 1347, 12 Genoese ships managed to escape, thus thinking of saving themselves, but bringing with them the plague, which slowly manifested itself in all the ports touched by the fleeing ships: Constantinople, Messina, Pisa, Genoa. Venice was also struck by the plague, which probably arrived there from Dalmatia in 1348. Venice was also a city that lived on commerce and that could not allow a prolonged interruption of trade, a city where people used to say that the soul of commerce is health. The city authorities, therefore, tried to react promptly and appointed 3 wise deputies for the preservation of health. They concentrated on measures such as the removal and immediate burial of the corpses in remote locations of the lagoon, thus hoping to contain the contagion. The plague remained a threat in Europe until the mid-18th century, and it would continue to be present in Asia and North Africa throughout the 19th century. Throughout the early modern age, Venice maintained careful surveillance of the plague epidemics that broke out in the Mediterranean, compiling reports and collection of news. Medical knowledge on the mechanism of contagion itself was then very limited. There was neither treatment nor prevention tools for infectious diseases. The existence of viruses and bacteria was completely unknown. The first vaccine was developed only at the end of the 18th century by Edward Jenner against smallpox, and the first antibiotic even later in 1928 by Alexander Fleming. Nevertheless, it was in Venice that in 1546 the physician Girolamo Fracastoro published his treatise on contagion, in which guessed how contagious diseases were spread by small particles invisible to the human eye. The measures of the Venetian authorities, however, were more a result of fear than of science, and aimed above all to show that the government of the Republic was not powerless in the face of the epidemics. For the following 100 years, health decisions were always taken sporadically and only when there was an emergency. Every time a new epidemic arrived, police controls were put in place, and as soon as the most violent phase of the infection passed, economic measures were taken to facilitate the arrival of new workforce and the exercise of productive activities. In 1440, however, a new commission was created, which for the first time did not have to fight against time to stem an epidemic, but had to carry out a study and draw up a report on the possible causes of malaria. They had a year to do so. The idea of prevention appeared. Then, after some experiments had been carried out in Milan, in 1485, Venice was the protagonist of a real revolution in the field of public health. It decided to establish the first permanent health magistrate, a very successful model that was soon followed throughout Europe. The Magistrato alla Sanità was chaired by 3 provveditori and 2 sopraprovveditori. These 5 were not doctors, they were politically appointed. The core of the Magistrato was therefore political and administrative, even if both a doctor, called the protomedico del Magistrato, and a surgeon were present. The tasks and prerogatives of the Magistrato were extensive. The health officials had first of all to prevent epidemics by implementing a careful control on mobility of people and goods. To do this, they controlled a dense network of information, scattered throughout the city and throughout all the dominions of the Republic. There were the so-called lion's mouth, to collect complaints against those who violated health regulations. Even today, one of these mouths can still be found along the Zattere in Venice. The penalties were very severe, even for offences which today may seem minor and which would be punished with just a fine. In 1751, for example, the carpenter Francesco Lorenzoni was sentenced to death for having tried to steal some silk bales placed in quarantine in the lazaret. The sentence was carried out by shooting in front of the seat of the Magistrato, a building demolished in the Napoleonic era, which was located in the San Marco area, where the Royal Gardens now stand.